The Waco-McLennan County Health Department has a warning tonight on a life-threatening problem for Central Texas parents. Good evening, everyone. Thanks for joining us. I'm Dennis Turner. Investigators have begun looking into 8 cases of whooping cough with no clear connection between them. Without that common thread, experts say there's no way to know for sure how the disease got here and how it keeps spreading. Norma Barrancos keeps a close eye on her girls. 2 arrived prematurely with weakened immune systems. So when she learned the Waco-McLennan County Health Department announced its investigation into 8 apparently unrelated cases of whooping cough, she took notice.
I have done my research because my kids were born premature, so I've always been aware of it.
And she's concerned about a recent rise in cases in Central Texas, cases that keep doctors like Celeste Hecox busy diagnosing pertussis. She says the first stage mimics a cold or flu, which most people treat at home. Dr. Hecox doesn't usually see patients until they reach the second stage of the disease.
There's not much fever or very low-grade fever associated with it, but it's a cough to the point of, breathlessness. They'll get really red in the face, and then they'll have this big inspiration, which that's where the whooping part of whooping cough comes from.
From there, pertussis gets even worse, with coughing fits that trigger intense vomiting. In the very young, whooping cough can kill, while in adults, it turns into the dreaded 100-day cough. Here's something I bet you didn't know about whooping cough. Unlike colds and the flu, pertussis actually happens more in the summertime. But we don't have to worry about getting whooping cough if we get one of the many pertussis vaccines available. They don't last forever, so you might need a booster, but they provide rock-solid protection in the event of an epidemic.
Those kids that have had at least one vaccine are going to have about half the symptoms, both half of the morbidity and mortality, as well as half the length of time of symptoms.
Meantime, Norma Barrancos aims to make sure her girls never even see those symptoms. She's glad to get the health department's warning. Now she'll stay a little more vigilant.
I guess a little bit more because mine are premature, so they easily get it.
One last piece of advice from Dr. Hecox. Pertussis is so contagious if you come into contact with anybody that has whooping cough, you need to seek medical treatment as soon as you can.